Colonial Behavioral Health exists as part of a network of 40 like community services boards across the Commonwealth of Virginia. In 1968, after some federal legislation was passed, there was a mandate that every locality in the Commonwealth of Virginia had to join with other communities to create what we call CSBs or to form their own. Williamsburg, James City County, and York County joined together January 5th, 1971 to form what is now known as Colonial Behavioral Health. And shortly thereafter, the city of Poquoson joined.
I see our Colonial Behavioral Health, so our CSB, really work to address what the needs are in the local community. And it's very similar to our local social services because we have mandated programs. But there's also things that impact our local community that we have to recognize. I think something that CBH does is not just say, oh, well, that's not in code, I don't have to do that. It says, okay, what's a local need, and let me help address that need because it's in our local community.
Colonial Behavioral Health is probably one of our oldest and most significant grantees. We started funding them in 1998. So it's been a long relationship with them, and we've seen a great evolution of their work over the course of that time, moving from focusing on individual programs to a much deeper relationship focusing on larger community health perspectives.
The statistics indicate that CBH, as a Virginia health service provider, has a level of assistance from its local partners that is almost unmatched in the Commonwealth of Virginia. And that's because we've had stable partnering relationships with our two cities, Poquoson and Williamsburg, as well as the two counties, James City and York.
In 2015, mental health services for active duty veterans and their families was established in the York Poquoson office. We established partnership with Virginia Veterans and Family Supports to provide linkage to wraparound services. In partnership with the Williamsburg Health Foundation, we established the Greater Williamsburg Network of Care website. In 2017, we received funding from Farm Fresh and SuperValue to establish a military and veterans page for federal, state, and local resources.
We've been working together as a partner for the last 7 years, and it's been a great partnership. Even despite COVID, we've had many challenges with significant volume in our psych patients, complexity for placement. They have been working remote, and so we've continued to work on our relationship despite what COVID brought to us. And we continue to innovate and work on other processes in order to get the patients placed and maintain our level of communication.
CITAC here in Williamsburg was developed as a collaboration between Colonial Behavioral Health and the local law enforcement agencies. Riverside Doctors Hospital was in the process of opening at that point. They came on as a partner as well. We're very interested in it, and through that we developed a whole wing of the hospital where we can take someone now who's being evaluated for mental health issues, and they can be observed and medically treated at the same time in this wing, and the officers can drop them off, and then once the paperwork's done to transport them somewhere, come back. And as an add-on to that, we've actually got a system now where there's a mobile transport that's when available that we don't even have to do that. So that's cut down a lot of the time that we have to spend with mental health people, and it's been a tremendous asset.
You can't just outsource behavioral health to CBH and say, you got it, we don't have to worry about that anymore. We being whether it's local government or whether it's the rest of the healthcare community, we have got to work in partnership. And that's hard. That means constantly working on relationships, constantly working through the 1,001 things that make organizations, each all with their own missions and purposes, work together. But that's what it takes to get the job done. And I'm just glad we have an organization in Colonial Behavioral Health that can lead in doing that sees themselves as a partnership organization.
Imagine what the service would be like if all four of us tried to undertake a mental health program on our own. So we get more bang for a buck, and we also have a level of service that would be consistent with a a much larger locality than would otherwise be the case.
So this community has really lent a lot of support to us, not just local government, but local businesses and individuals and donors and contributors. So we are dependent upon and grateful for the support that the community has given us.
One of the areas where I've seen a huge impact with CBH has been with the Williamsburg Child Assessment Center that CBH has set up. This has had a huge impact in our community as we have seen families who have significant needs for their children to be assessed around behavioral health issues as a resource for them to turn to, where in many communities that doesn't exist. And without that work with CBH, I think there would be a lot of families who were not seeing the needs of their young children being addressed.
The fact that it's existed for 50 years and is still well thought of in serving the needs of a really, as I said before, a diverse community. It's not only Williamsburg and James City County, it's also York County and Poquoson. We are all together in this, and this fight is going to continue, and as long as we have Colonial Behavioral Health leading the charge, we are going to overcome many of the mental health issues. We're going to overcome the substance abuse issues. And each and every day, there's a new challenge, and they are up to the challenge.
The vision for the next 10 years includes a new campus in the Williamsburg area that supports integrated primary care, behavioral health, and dental care. Our presence in the community will expand to include permanent supportive housing and employment services. To achieve this, community partnerships will be key to our success, just as it has been in our past. And your continued support and collaboration are invaluable. And for that, we thank you.